Hello, everyone. Welcome to Industry Matters. I'm Mandy Rogers. I am VP of Marketing for VGM and Associates, and I am so excited to have with me today the government guy. Some of you might know him as Mike or Ike Isaacson. He's our SVP of Government. So thank you so much, Ike, for being with me today.
Absolutely. I'm happy to be here, Mandy. Thanks.
Yes, and I mean, your title kind of says it all about what we're going to be talking about today. And, government's so funny. It feels like it's kind of feast or famine. There's either nothing happening or it's happening so fast we can't even keep up.
Yeah, funny is not necessarily the word I would use, but yeah, it's definitely never dull. In the 20 plus years I've been doing this, I have to admit though that this last probably 2 months has been probably the fastest paced I've ever seen information coming out and changing and just, yeah, there's just a flurry of stuff. So I'm really excited to just kind of break down a little bit of it with you today because there is plenty to do.
Awesome. Well, before we dig into everything, I want you to just tell me a little bit about the government team because we've had some shifts over the past year, I would say. So just familiarize our listeners a little bit with what your team looks like now.
Absolutely. I'm really, really, really excited with this group. We're a little bit smaller team now, but Adam Miller joined us in January. He is the Vice President of Government Relations. Adam had started with VGM years ago in insurance. And so he's actually a name that's familiar to a lot of our state association partners and a lot of our members from across the country as he worked in insurance. He did a lot of those same conferences and the shows and such. Adam and I have been working on legislative stuff through his most previous role was the president of OPGA, our Orthotics and Prosthetic Group of America. And so he got really into the legislative work that was happening around there with AOPA and the Alliance and all those different things. And so when I was kind of looking around the building for somebody that I wanted to help me out, with John Gallagher obviously retiring at the end of the year, Adam was really a natural fit. He was engaged in the political piece of things, the policy stuff. He understood it. So yeah, super excited to have Adam. So he'll be coming to a town near you as we're both hitting the road just about every week. And then, you know what? The mainstay of our government team, the glue, the one that knows everything, that knows where all the secrets are and which buttons to push, Emily Harkin. I can't say enough about Emily. Again, and I'm sure anybody listening probably knows that name already. Emily is absolutely 100% the heart and soul of the work that we do. But she's going to start to do a little bit of changing in her role as well, because, she's sitting on a lot of years of great information and great knowledge. I want her to share that. And so you're going to start seeing Emily getting out on the road a little bit and sharing what she knows. And from her perspective, her superpower is scheduling. She knows every DC scheduler out in that city. So happy to have Adam and Emily working out right alongside me and trying to do as much as we can for this industry.
Yeah, absolutely. Small but mighty.
Yes.
Perfect.
Well, and part of our task too, though, is it's really kind of cool because we still touch on everybody across the building, right? So if I need something around oxygen or Medicare, Rhonda's my person, Rhonda Burmeister, right? Payer stuff, I'm still hollering at Craig Douglas. It's just given us an opportunity to expand our scope a little bit and do more work across the VGM building for all of the partners that we have across the country.
Yes, absolutely. Okay, well, with that, let's start with DME relief and the 75-25 blended rate and what that looks like. Tell me a little bit about what that is, where we stand, just everything we kind of need to know there.
Yeah, absolutely. I'll be honest with you. I was really hoping to not be talking about 75-25 this year. We've spent so much time, and so many of our members and our industry stakeholders and our partners, we've spent so much time on the DME Relief Act. Again, that's that 75-25 blended Medicare rate for the non-rural competitive bid area. So just really quickly, because I could go in a rabbit hole on this and talk forever, but there's a set rate for the urban and there's a set rate for the rural. But this non-rural rate, a couple of years ago, it's been year after year after year, we've had to update it. Well, a year and a half, 2 sessions ago, they didn't update it. And so we continued to push for that non-rural area. So that's come back up again. We did not make it into this package actually that was supposed to be now, but it's turned into a continuing resolution. So we've kind of kicked the can down the road a little bit more. And of course, at a federal level, we're going into a budget reconciliation process. And so there's another opportunity to get that going. But we're super excited. Once again, Iowa's very own representative, Marinette Miller-Meeks, is leading the charge on that out of ENC. And again, Representative Tonko from New York is joining her. Once again, they were the same lead sponsors on that last year. But what's really cool about this year and what makes me even more excited about the potential success for us this year is it's also at the same time came out of Ways and Means, which is both of those committees on the House side have jurisdiction over Medicaid, Medicare, and all those kinds of issues. So to have those both come out at the same time in concert and working together is fantastic. The other part of it too, right, with VGM being headquartered here in Iowa, once again, super excited that Representative Randy Feenstra from the western part of Iowa is leading that charge out of Ways and Means, along with Representative Panetta out of California, where we've got some amazing members that have done a great job developing relationships. So the four of them are spearheading that bill, and we're getting excited to start hitting the road and getting more and more people involved.
So what needs to happen, right? They're spearheading the bill, but what's that mean? Like, does the membership, what do our vendor partners, like, what do they need to be doing to help not have to be talking about this in another year?
Yeah. They need to be doing everything. No, we need to be reaching out. And so many of our state associations and our members through that and on their own are doing such a great job, even leading into the session this year, getting their legislators on board. Their representatives need to get on board with this bill. So we've got resources on the VGM government page that can help you write your own letter, or you can simply put in your information, hit a button, and push it off. I'll be honest, I like when our members take the information but write their own letter and make it their own, because they have so many amazing stories about how their services are helping people, especially in those non-rural areas, which quite honestly, at the end of the day, when you look at that map, pretty darn rural. Right. Yeah. So how they're helping, and, those stories go such a long ways with those representatives and those legislators and their staff in really painting a great picture. So, part of the reason that Adam and I are running all over the country right now is just connecting those members and those state associations that do such a great job with the representatives and with their state staff, right? Because those state staff have a lot to do with the constituent services folks. I want every one of our DMEPOS members to have a relationship with those district offices, because those are the offices people call when they're having troubles finding equipment, when they're having troubles finding services. And if we can be in those offices and creating those relationships, we're now a solution for that state staff. And so when their boss asks out in DC, they can say, you know what, this company is really doing a great job. And so that's really what we're promoting, just more champions of change. You'll hear us say that even more this year, because that's what it's going to take. So everybody getting involved, everybody getting on board. And I always tell people it can be intimidating. I get it.
Right.
But these are just regular old folks, right? And at the end of the day, our members are the experts in what they do. Those legislators aren't. So you're already starting a leg up. But if people want help in reaching out, if they want help with having a site visit, getting staff for the legislators on site, that's what we love to do. We've got a playbook for that. Adam and I, or Emily, will be right there along with you, and we can do all the scheduling for you. We can give you all the information you would need, the leave behinds, the takeaways, all of that stuff can happen through the VGM government team. So I'd really say, if you're into it and you do it, fantastic. Thank you. If you're a little hesitant on the fence, you've got all the support you need right here at VGM.
Yeah, really, it's kind of it's all there for you, right? Like trying to make it as easy as possible to have that communication and do what's needed. So that's a great resource for sure. Switch gears a little bit. Let's talk about the titanium carbon fiber bill. What does that look like?
Oh, man, that is another great bill. It's an interesting bill, to be honest with you, but we're super excited. Once again, Senator Tammy Duckworth from Illinois and Blackburn from Tennessee are spearheading that on the Senate side. That's Senate File 247. They are just amazing advocates. And we've got some great relationships with both of them through our members in Illinois, as well as our members and our vendor partners out in Tennessee have just helped so much with that, so that these folks know it, right? And Tammy Duckworth has been a long time champion of our industry. So we're really excited to have them on board again. And then also just recently, the House picked it up as well. So we've got Representative Joyce out of Ohio, and then Representative Buchanan out of Florida. And again, great connections all across the board. Buchanan is a heavy hitter on Ways and Means, so that's really good for us and puts us in a spotlight with the Chairman Smith out of Missouri, who heads up Ways and Means. But again, that's a bill. It's a really, why I say it's interesting, because I'm sure people are like, yeah, politics, that's really interesting. It is. Trust me. This is one of those bills that I love to work because there's no price tag to it. Okay. There's not a CBO score to it, because it needs to be there because of an interpretation by CMS. For the longest time, folks were able to get their their share paid through Medicare, right? And then they could choose to upgrade it to that titanium carbon fiber, lighter, easier on their body, longer lasting. But it was up to the individual patient. They would pay that over the top of what Medicare paid to get that upgrade. Well, an administration came through and looked at it and said, no, those rates are supposed to include all of that, which is interesting because I believe the original rate was from 1993. And there was not a whole lot of titanium and carbon fiber work being done.
Not really
what we're trying to do, what we're trying to do with this bill is just get a new interpretation, because how it really came about is if you got a chair back then and could upgrade, those folks, their chairs were coming to the end of their useful life. And so they were eligible to get a new chair. And they came in, I said, I want the exact same chair, but they couldn't get the upgrade because it wasn't covered by Medicare and it's too expensive to cover through the current rates. So really what this is it's just fixing something that should have never been broken. And it's an interpretation piece. So again, love working bills that have a 0 score. There's really no excuse not to move forward with it. We may have to overcome some made up ones, but we will go ahead and make sure that we continue to work on that. And that's, once again, from a member standpoint, it's just a matter of communicating. It's communicate with your legislators. Let them know, hey, this bill is out there. I'd really love for you to sign on. Here's how it affects my business and your constituents. Tell that story and get them to sign on. You're going to be a broken record while we talk, because it's just really that simple. It's making the phone call. It's sending the letter. It's sending the email. It's contacting staff to ask their legislator to sign on. The more we get signed on, the easier it is to move it through the process.
I mean, really, you go to the website, right? You go to VGMGov.com. You go to the take action. You can do it both at the same time, right? You can send the email.
So easy.
It's so easy. That's right. So it's all right there. So that's fine. I will also sound like a broken record.
Yeah, no, I'm the last person to take a look at that, because I figure if I can do it, then we're good. Because I am not good. These computers still freak me out. But if I can do it, I think anybody can do it. And if, again, like if you want to personalize a letter, fantastic. But if you just want to type in your information and hit send, that's great as well. Anything helps.
Perfect. All right, now let's talk a little bit about what most of America is probably talking about, which is tariffs. I feel like it's a bad word. I don't even want to say it, but not that you need to have all the answers, because I don't think anybody does right now, but it is something that all of our members and vendor partners are wondering and trying to figure out, right? So what can you tell us that you've seen or updates, any news on the tariff front?
So tariffs. I started out by talking about this has been the craziest session to start with that I've ever had in 2 decades of doing this. There is so much information and so many talking points and so much news about tariffs. Behind the headline, there is very little detail and very little applicable information that we're able to get. Tariffs are a super complex thing. It's really not as simple as, hey, there's a 25% tariff with this country, therefore product X is going to go up 25%. It doesn't work quite that way. Behind the scenes, there are different trigger points that can be set up. We don't know what those are, but let's say country X, we say a 25% tariff, unless you purchase X, Y, or Z amount from the United States. Right. So if these other countries hit their purchasing thresholds, this is one of the ways it can be set up. They hit that purchasing threshold, that 25% tariff doesn't come into play. Or it could be some variation of, if you purchase this much, it's only 15 or whatever. Now, let's make it even more easy to understand. Absolutely not. The import of record in the United States, it's actually bringing that product into the country, is actually then the one that prices it. So they can choose to either turn around and pass along that entire increase to the consumer or the purchaser within the US, or they could modify their margins and it could
Right.
be a different percentage as well. So when people call me, and daily, I think before 9 o'clock, I had 3 calls this morning, and I'm trying to find specifics as well. The challenge is it is such a convoluted process. I realize there's very smart people doing this stuff, and I'm hoping that these things work out. But at the end of the day, a lot of the folks I'm talking to in the manufacturing sector are kind of taking a bit of a wait and see approach because nothing's
Okay.
really quite hit yet. And I say that, I'm sure there's somebody saying, well, wait a minute, because it changes every day. For instance, I left Friday thinking, hey, I think we're going to be good. I don't think we're going to be a part of it. I came in Monday going, oh, we're absolutely in the middle of it. It's that kind of a topic. What I would say, though, is I don't want people to necessarily panic about it. I think we're going to start putting out more and more information, and whether, I can't necessarily say I'm going to put out answers, but I want people to follow it and read it and continue to figure out how is this going to affect, because obviously our members can't pass on cost, right, through the Medicare
Right.
piece. And so we've really got to take a look at how all of the different factors are going to come into play. We've got another round set to hit. I think it's April 2nd. That could hit. But between now and then, we could pull something back, or we could change something, or the countries could come to a different agreement. So it does make the job challenging, but I can't imagine the confusion and some of the frustration. Obviously, I hear it on a daily basis. And as much as I hate not being able to say, do X, Y, and Z, and you'll be fine, what I can say is really watch it, really monitor it, pay attention to, global indexes and those kinds of things. Keep reading, even though it just feels like we're being inundated with information. Read with a critical eye to pull the things out that could affect our business. And again, we're going to continue to lead on trying to get that information out to people. I would love to be able to say it's this or that. At this point, I say let's just continue to watch and be ready.
Yeah, absolutely. Well, I mean, you and I have joked, not about the tariffs, but have joked about we needed to pay a little bit more attention in economics class and trying to
Yes,
figure out how all of this kind of breaks down, because it feels like a really complicated calculator that needs to happen if X then Y and all the things that kind
100%.
of go into it. And I know that, like you said, we're monitoring and we're working on some resource links to help people be like, okay, look here, like this is a good, credible source. Go to
Yeah.
this location and not this one. So obviously for everybody watching and listening, just keep your eyes and ears peeled for that, because we're going to do all we can to help through this process as we all kind of learn together.
Mm-hmm.
Okay, let's talk now about just kind of Medicaid and Medicare. Like, what are some of the challenges that we're seeing in this segment? We're kind of winding down the first quarter of the year, which sounds ridiculous, but we are. So what are we kind of, other than everything we've already talked about, are you
Right.
kind of seeing as some of these things coming for the rest of the year?
Yeah, as we're watching, obviously, most folks have seen the headlines about the Medicaid desired cuts or the potential for the cuts. I think it started at $880 billion. We're down, I think the last number I heard, maybe in that $500 billion range. This is another one that, once we get into the budget reconciliation process, we're going to start to get a much better feel for it. I will say traditionally that Medicaid and Medicare has kind of been the third rail of politics, meaning legislators are very, very hesitant to touch it. Now, that being said, to get to the budget numbers that they say they want to, if we're going to take those numbers literally, the only way to do that is through some cuts with Medicaid. They're saying now they're not going to touch Medicare. They don't have any intention to cut Medicare. Again, don't know how realistic that is in order to get to the numbers, they said. However, what we know historically is what the goal isn't always where we get. And so now I think we're going to get into, I think the news around that may slow a little bit because it's going to start to become scalpel time. Right now, it feels like everything's being done with an axe. We're going to fine tune and drill in, because as you look at that Medicaid program, there's states that have as many as, 1 per 4 child is reliant upon Medicaid for health care. We've got our seniors, the dual eligibles, a lot of those things. So that's another one where I want to monitor it really closely. If I were to just put on my prognostication hat, which I don't ever want to do, but I'm going to with this, I think that number is going to be far lower, because I think the closer they get to seeing the impact that it will have, I think they're going to have to back off and try to find some of that elsewhere. There's a lot of talk about, the work requirements. which, okay, I get that, but that's a really small sliver of those Medicaid dollars. That's a real challenge when it comes to that, because a lot of those Medicaid folks, having worked in that industry for a long, long time, are working. But our system is set up that you can't work too much or you'll lose the benefit. So that's where you're starting to see a lot of states start talking about right to work laws, right? Where it allows people to make some more money so they're not as reliant upon the Medicaid. So I think there's so many different variations. Again, that's going to be a wait, watch, and monitor. We're going to make sure that if there's anything that pops, we're going to let our members know, and we're going to want some action quick. But in the meantime, we're having those discussions with the Chairman Smiths, the Chairman Guthrie's, with HHS, CMS, and those folks, just to continue to try to get us ahead of the game and get a direction as soon as we can.
Well, you said it earlier, we know the industry, right? And our providers know the industry, but people up in DC and on Capitol Hill, they might not understand. 1 in 4, did I hear you right? 1 in 4 families have a child impacted with Medicaid.
There are states
huge.
in certain states that is the number.
So it's things like that where that's what they need to know, right? Like, this isn't just we're complaining because we can't fund ourselves and do business. It's like we have end users we're actually concerned about and trying to impact here, which is, if I'm going to get on a soapbox for 2 seconds, why what you guys do on the government team is just so important for our membership and for vendor partners, because it just is. I mean, we need the access to care and the providers to be there. So thank you for your millions of hours that your team spends on the road, because I know it's a lot. Okay. Anything else that we need to talk about or that anybody needs to be aware of as we kind of close out today?
I think that these are the hot button issues right now in the industry. What I really want people to focus on is coming up with their story. Very honestly, I love going around the country. I love going to DC. I love representing our members in the industry. But at the end of the day, they look at me and they're like, they know what I'm doing for a living. Where the stories come are from the boots on the ground, the folks that are doing the amazing work to keep people in their own homes, near family, near friends. Those stories, we've got to lift those up. We've got to not be afraid to tell those stories. The members are the experts on this. They have the firsthand experience. They are the constituents who are taking care of the constituents. It is imperative, more than probably any other point in our industry history, and that's not hyperbole, that we raise the profile and show, because we've got study after study after study that shows the amount of money that DME in the home saves overall for Medicare. And until we're able to articulate that, until our members are able to tell that story, that patient story, we're going to continue to struggle, because we continue to look like a commodity transaction-based business. We are a service, and that's the message our legislators need to hear loud and clear, and that's the message that I'm carrying with me wherever I go around the country.
Yeah, we have to connect those dots, right? Like, you can't expect them to government to connect that dots. Like, that's what those stories do. It puts it all together for them, and just this is why we need to be doing this.
It adds to the data. Right? Like, we have to have the empirical numbers. We have that. But the stories bring that data to life.
Absolutely. Absolutely. Well, again, VGMGov.com, people can submit and they can go there, they can take action and do all the things that we need in terms of submitting letters to their legislators and help keep moving the needle. But I thank you again so much for being here and talking about these important topics, and for everything your team does to impact the industry.
Well, we've got a great job because we get to tell the stories of our amazing members and the work that they're doing, and we'll keep doing it. We just need everybody's help this year.
Thank you.
Thank you, Mandy.